Hello, YouTube world, friends, family, viewers, and subscribers. Welcome back to the Critical Cognitive Aggressive Thinking channel. My name is Robbie Williams, your host, and I'm here to bring another episode on this channel. And we're going to dive in and get some knowledge and raise the awareness on kidney stones. So our topic for tonight will be kidney stones. They will sneak up on you. And I say that because of the way my diabetes sneaked up on me. But we're going to talk about this in a way that you're going to know that there are things that you can do prior to a kidney stone to make life easier for you so you won't have some severe issue where you're being hospitalized and having surgery just to get one out, because they will have to go in you and crush that stone just to get it to pass if it gets too big. So without further ado, let's just jump right on into this information. Thank you all for joining, all of my new subscribers. I want to say that before I really get into this. I want to just show my appreciation for all of you who thought enough of coming aboard. So I'm trying not to let you down by bringing out good information. Let's talk about kidney stones. Now, kidney stones are the most common health disorder associated with the urinary tract system. So when we talk about the urinary system itself, kidney stone has made its mark. It probably earned an MVP to do what it does to hurt us in that area. But we don't want that. So that's why we're learning about it. And this channel is bringing you the knowledge tonight. Let's first get a definition of a kidney stone. So I had to do my due diligence to gather some data and various definitions and compile it and just say, okay, I want something that is not too highfalutin and not too elementary. So kidney stones are hard fragmented of minerals, also known as renal calculi, nephrolithiasis, and urolithiasis, which are characterized by the formation of solid deposits composed of minerals and salt inside the tissue of the kidneys. Now, that's the definition that'll give you some meat and potatoes about this dreadful problem called a kidney stone. Kidney stones can be caused by a variety of factors, including poor diet. And you can see some of my other videos where I talk about diet. Like myself, I'm on a Mediterranean diet, consists of mostly vegetables and some meats, less meats than I used to eat. Okay? Excess in body weight. In another one of my videos, I talked about obesity. We will talk about this more too, because it is a contributing factor to the development of a kidney stone. Follow me on this. Certain medical conditions can also be a contributing factor to kidney stone, and certain drugs and supplements. So you can be prescribed certain drugs that can have what we call an adverse effect on you. And it can lead to a kidney stone. Just like there's some drugs out there that you're subscribed with that will cause you constipation. Same thing, same difference. You see, so when you're prescribed drugs, you want to have a good understanding of what this drug doing to you. So you talk to your PCP. That I'm going to always tell you to do that. Everybody have a doctor that they chose to go to as a primary care provider. When you go to that primary care doctor, you ask questions. Hey, what would this medication do to me? It's not going to hurt. It can only help. Buying supplements from like GNC or Vitamin Sharpie, I do that because I'm the type of person that the less prescribed medication, the better for me. But I will always check with my doctor and say, hey, listen, I'm planning on taking this. What do you think? Because I'm a diabetic, I need to know if it's going to have some type of a adverse effect on my body. So I have to run it by the doctor first, my PCP. That's what they're there for. You are paying them for that. If you're not, your insurance paying them. So get that knowledge. Get that knowledge. Moving right along. Let's talk about signs and symptoms that you need to know about leading up to kidney stones. Some people experiencing kidney stones generally will have pain in these areas, their side, their back, and their abdominal area. Now, that's not saying those are the only places you will experience discomfort or pain. It's just saying this is common. So we're going to step into some more of that. But check this out. Other symptoms include being nauseated, passing blood in your urine, that burning sensation while you are urinating. You feel that burn. It's very uncomfortable. It's like a UTI. And women experience those UTIs a lot more than men. So they know what I'm talking about. When you're passing urine and it has this funny looking color to it, real dark, and it just like, you're asking yourself, what I'm drinking to make my urine so dark? So that's another sign you need to be looking at. Dark urine. Another is a strong smell. When you urinate and you just smell it like it's just going up in the air, you just smell that strong urine. You need to be checking with your PCP. You need to be asking questions. Even if even if it ends up being a false alarm, it's better for you to have a false alarm and know that everything's all right than not to know that everything is all right and it may be the real thing. Because there's many other urinary tract problems. Okay? If you're not getting enough liquids, and I highly recommend water. Water, 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 water. Highly recommend it. Because water can work a lot of miracles for you. If you don't get enough fluids in you, it can be, you're very highly prone to having a kidney stone. And I will tell you this, you can go and read in a medical journal, you can read any PDF file on medical, you can read anything about water intake, fluids. They would tell you that you need at least 60, 62, 63, 64 to 72 to 74 ounces of water a day. 64 to 72 ounces of water every day. How many of us do it? I struggle with it. I ain't gonna lie. But when I get up in the morning, I drink 8 ounces of water at home. I pack 3 bottled water, sometimes 4, with me to go to work. And I drink them all. My goal is to drink all of that water before I come back home. Because I'm trying to keep that fluid going, that fluid intake. Mainly water, mainly water. Okay? So don't cheat yourself on that. Because if you don't, you're prone to getting a kidney stone. And remember this, I will have links to my research on this in the description box. So you can go to that description box when you watch this video and you can pull up and you can, you want to copy and paste or whatever you want to do it and put it in a search engine and look it up, do that and read up on this stuff because it is powerful information. Save your life. Do your due diligence. Now we're going to move into certain health conditions. We talked a little about it, but we're finna dive into it right now. Certain health conditions associated with developing kidney stones. Number 1, gout. How many people ever thought of gout being a problem that can enhance or increase the chances of having a kidney stone? But gout is characterized as a disorder that causes painful swelling within the joints. That's my number 1. Number 2, digestive problems like gastroesophageal reflux disease. Some people call it GERD, and some people call it acid reflux. It's when things run backwards, trying to come back up the tube rather than going down through the body system, the digestive system. And I know people that had acid, they just be like holding their chest sometimes. It's terrible. But that can also cause kidney stones. And all of these things I'm talking about is if you leave it untreated, if you don't go and get treatment for this, it can even cause more serious chronic illnesses. So stop playing with it. Because I mean, you know, we can talk noise all day long until you land up in the hospital. The hospital ain't no joke. I don't like it. I'll be the first to tell you. Hyperparathyroidism, my number 3. And that's a condition in which the parathyroid glands release too much parathyroid hormones into your body. You see, that can cause, untreated, it can cause kidney stones. Number 4, reoccurring or repetitive UTIs. Women know this. And I'm not going to say men don't have UTI. I'm saying women are more prone to have UTI. So they know more about it. Women talk more about UTIs than I ever hear men talk about it. And if you don't take care of yourself, that can lead to kidney stone. Going back to obesity, I remember in one of my other videos, I talk about the body mass index chart, how you can check, how you can get the numbers, and it'll tell you whether you're overweight or not, because it'll give you a BMI. give you your body mass index number. And when it give you that, you check it with your weight and it'll tell you. So watch your weight. That's why I say vegetables. That's why I tell you, you don't have to eat 2 or 3 plates. If you can't control yourself at a buffet, don't go to the buffet. Because I know that food will call your name. My number 6 is cystic kidney disease. This is a disorder that causes fluid-filled sacs to form on the kidneys. All of this stuff goes untreated. You're looking at a kidney stone coming up, possibly. Okay? And it talks about within the United States, and when we talk about, we'll say, well, who's more prone? Men are more prone to pass kidney stones than women. 13% of men, I mentioned it before. 13% of men in America suffer from kidney stone. 8% of women suffer from kidney stone. Only 8%. Kidney stones are also more common in people who have diabetes and is obese. So I'm in the group, whether I like it or not. So I say that to say this: we must take care of ourselves. If all of my diabetics out there, you're in the number. Drink plenty of liquids. Find more healthy liquids to drink. Because remember, these are hard mineral deposits that forms inside the kidneys that creates the kidney stone. So that means anything you take in your body, those fluids you taking in, if it's not healthy fluids, clear fluids, you're putting yourself out there. That's what I'm saying. Every year you will find kidney stone cases in America. And it says within the US population, based on a research study, scientific, an underlying contributing factor was found in men presenting that their kidney stone were linked to inflammatory bowel disease. Hold up, hypothyroidism, hyperparathyroidism, urinary tract infection, and prolonged immobilization. Cannot stress this more. Men are more likely to develop kidney stones than women are. And if you're running a fever and suffering from a kidney stone trying to pass through your body, or if you have a urinary tract infection and trying to deal with a kidney stone trying to pass through your body, this is an emergency situation. You need to be at the hospital. You need to be at the hospital. You need to be laying around the house talking about, oh, I'm going to just do this and I'm going to do that because this will fix it. You need to be at the hospital. I cannot stress this. I cannot be more straightforward right now. This is nothing to play with. I don't want to deal with the pain of a, no, I don't want to deal with the pain of a kidney stone. No. Okay. So, nonetheless, most stones are passed naturally between 31 to 45 days. I don't know if that's a good thing or not, because that's a long time for that stone to be up in me. I can't do that. I'm just being honest. Bring on the water. Bring on whatever I need to make sure I don't get one, because I ain't trying to hold on to one for no 31 and 41 days, 45 days. Nah, can't do it. If the stone has passed within that time frame, or hasn't, let's say hasn't passed within that time frame, it is important that you get medical attention ASAP, because this can increase the risk factor of damaging your kidneys and causing other complications. Now, during this process, most physicians, nearly all of them, will tell you, they will recommend that you drink abundance of water. And in addition, they're going to want to get samples. Hopefully they can get a sample of the stone itself so they can run an analysis on it, just like they do a urine analysis and other kind of analysis. They want to find out what is this? The main thing about this video is, people, take care of yourself. Love yourself. Nothing wrong with that. Try to make sure that you put self-care first, because you're no good for nobody laying up in the hospital, going through all these surgical problems because you didn't do self-care on the front end. And now you have to get it done on the back end. You see, do it from the beginning. You don't want to wait till late. I want to say, I thank all of my new subscribers. Yes, I have more to come. Don't get discouraged if I don't post in a little bit. Send me a message. That's what someone else did. Say, we're waiting on another video. I said, oh, okay. Let me make time, because I am busy. I do a lot, but that's just my life. But I love promoting these videos and putting them out there. And so I want to thank all of you that watch my videos, that gives me a thumb up. I appreciate it. Let me know you like my video. Share it with other people so that we can get this out. We can get the word out. And I want to just say, have a blessed evening and good night.